The clinicians, I think, once they realise the benefits, will be quite excited by it. I don't think they can continue to work under the burden of the increasing information that hits them every day and the amounts of paper that they're still having to deal with. I think that's a real challenge for them. Are they sure that they're getting the best information to help them treat that patient? It will be at a touch of a button on a computer, there, available for them. The assessment will be theirs, but the information will be there at the touch of their fingers, whereas at the moment they probably have to spend a lot of time seeking out all the information.
But it is possible that using a digital model, we should be able to refine that answer in a way that brings in all the various factors that relate to that particular patient, such that you get a more precise evaluation of your health status.
The health records should be accessible anywhere in their entirety, but the complication at the moment is that they're not. Local notes are held locally, and you either have to phone up, you have to know that they exist elsewhere, and you have to try and phone up to get hold of them.
In terms of the whole consent process and taking the patient through the journey of what was going to happen to them, they found these new technologies really quite valuable in that context.
There may be another role in terms of communicating risk by forward projecting 3D representations. So, for example, with risk factors for atherosclerotic disease like smoking, obesity, it may be possible to forward project a three-dimensional image of that patient's coronary arteries, for example, illustrating the formation of atheroma under different conditions.
So we won't be waiting for things to happen to us. We can predict them, we can prevent them, we can manage them, and that's going to be a huge revolution in healthcare.
Healthcare, it's going to bankrupt every single European state in 20 years if we don't change model. Everybody knows this. We have two ways here. We can cut service and push us back where we were at the beginning of the 20th century when healthcare was a luxury that only very few people had, or we can embrace the future. And technology remains the best answer. This has been proven over and over. So we think that investing in ambitious technologies like the digital patient in the medium term will pay back massively.
So DISCIPULUS as a project is looking at the future trajectory of these technologies, how they might become embedded in healthcare, and what healthcare benefits might arise from using them.
And I suspect that the digital patient would provide me some real exciting opportunities to model premature birth in a way that I couldn't do with currently existing technologies.
Currently there's no way of actually knowing for sure whether a particular mechanism can cause a fracture or not. So to have a digital, a virtual patient to whom you could subject any sort of trauma ethically would be fantastic.
The digital patient will help us to have that window on the possibility of the future and help guide clinicians and patients to make the wisest possible decisions. It's a fantastic opportunity.